And what I'll do is mute once before we start, I'll mute everyone, obviously apart from Alison. And I'd like to welcome Alison to our group and thank you very much for coming to join us, and welcome to all you ladies for joining us. It's really great. And so I'm going to mute you all apart from, oh, now I'm going to make you the co-host. There's Nadine. So you can, if you can unmute yourself, Alison, because I've managed to unmute you as well. But yeah. Thank you. I'll leave it to you now, Alison. Thank you.
Thank you, Jackie, and well, thank you everybody for having me on this session. The session is about somatics. It's a whistle-stop introduction into somatics, and we're going to be doing. I'm going to teach you. It's going to be about a half-hour practical session and of seated somatic movements, which are going to be very useful, especially at the moment when we're sat in front of computers a lot of the time. You'll find the movements that I'm going to teach you quite beneficial in that respect. But a lot of somatics is done lying on the floor, and you can also do it standing. My name is Alison Emery, and my business is called Move with Awareness, because with somatics, a lot of it is about becoming more aware of how we move, and just being more in tune of how we feel in our bodies. I'm also a clinical massage therapist, and my aim is to focus and work with people to help them out of pain. I've been a massage therapist for 10 years, and I trained at the Jing Institute down in Brighton. But I got into somatics because I found that times when I was treating people in massage, though clinical massage is very effective, sometimes it just felt like there was a missing link. Get people to a certain level and couldn't seem to get them any further. And so I started looking for other things, and that's how I came across somatics about 5 years ago originally. And it sort of blew me away, really. So now I use a bit of a combination with massage on the one hand, and then somatics is great as a self-care thing, self-help technique for people to look after themselves. But what is somatics? Has anybody ever heard of somatics or done somatics before? No, okay. And can everybody hear me all right? Because it's not brilliant. So some of you look like you're frozen. Jackie, can you hear me all right? Yeah, okay. All right, so if there's any problems, then just try and let me know, because my connection isn't good. So I trained with a company called Essential Somatics, and Essential Somatics evolved from Hanna Somatics. A guy called Thomas Hanna coined the phrase somatics back in the 1970s. Sadly, he died quite prematurely in 1990, but he had trained quite a number of people in the field, and it's evolved to what it is today. Now, the interesting thing about somatics is that there's a specific principle that he talked about, and that is to say that we're connected as a system. So there's no such thing really as a bad back or a bad neck or a stiff shoulder. The brain can't distinguish individual parts. And what that means is that if there's a problem in one part of the system, there's a problem in the whole system. So somatics looks, or somatic movements look at the whole system. We don't just focus on isolated parts of the body. And the reason why we get problems with our bodies, stiffness and pain ultimately, is due to a buildup of muscle tension, because our muscles become chronically contracted as a result of how our bodies respond to stress. And we're all exposed to stress on a daily basis throughout our lives. And I'm not talking, big stresses like a bereavement perhaps, or moving house, although they do count. but I'm talking about daily stress, such as you know, running for a bus and missing it, or running late to an appointment, or even the phone ringing. That can trigger a response in our body. Carrying a child on your hip over a period of time because it's a repetitive action could evoke some stress in your body. So things like that, and there's lots of other examples, and we're exposed to these kind of stresses on a daily basis, and this results in our muscles tightening. But what happens is the brain, although it knows how to tighten the muscles in response to stress, it forgets how to release them. And we respond to stress in this way. Thomas Hanna identified 3 specific stress reflexes. So as it's a reflex, it's spontaneous. It's not something that we can consciously control. And the reflexes that he identified were called the red light reflex, the green light reflex, and the trauma reflex. Now, the red light reflex is also known as the startle reflex or the withdrawal reflex. It's primarily a protective reflex. It's what keeps us safe. And just like the name, the withdrawal reflex, it's something how you would withdraw into your body. And this results in our body on the front of the body, the muscles on the front of the body becoming tight. And that can cause things like neck pain. It can cause breathing problems, digestive problems, emotional things such as anxiety and that sort of thing. And stresses that might trigger that could be going for an interview, say, for example, being worried about something, being scared of something. But also more recently, due to technology, sitting on computers for long periods of time. You're probably all familiar with the forward head posture. This is because we're sitting like this on computers, our backs are rounding, our shoulders are rounding forward. That is the startle reflex. It's something that we're all familiar with, a posture anyway. The other reflex is called the green light reflex. And the green light reflex is where muscles on the back of the body become tight. The green light reflex is also known as the Landau reflex. And this reflex comes into play originally when a baby is about 5 or 6 months old. It's the reflex that enables a baby to initially lift their head up and then eventually come to crawling and eventually stand and walk. It's the reflex that moves us forward. But it's also the reflex that's triggered if we're in a rush to get somewhere, if we're late for an appointment. You know, you might know when you're hustling and bustling around, this is what's being triggered. And it's the reflex that can cause back pain, sciatica, SI joint problems, things like that. And then the last reflex is called the trauma reflex. And this is when something is affecting one side of the body. So it could be due to an accident, a fall, twisted, sprained ankle, an operation on one side, doing something repetitive like playing a sport like golf, or carrying a child on your hip, those sorts of things. And this can commonly cause, again, sciatica, knee problems, hip pain, and that sort of thing. So the thing is with these reflexes is that what's happening is that the stress that's causing the muscles to become tight, the brain can't remember how to release them. And Thomas Hanna referred to this as sensory motor amnesia. Sensory referring to the nervous system because the brain controls muscles, motor referring to the muscular system, and amnesia to forget. So basically this connection between the brain and the muscles has been lost, and that's why we end up perhaps not moving quite so well, but we don't realize we're doing it. That's why we have these default postures, but we don't realize that we do. And what somatic movements do is somatic movements they recreate these stress reflexes in order to decreate them. And they target the nervous system, they target the central nervous system so that we can help to re-establish that connection. Sorry, I got a bit distracted then because suddenly lots of people vanished from my screen and it threw me a bit. So sorry about that. Now, one of the techniques that we use in somatics is a technique called pandiculation. So we don't do stretching, we don't do strengthening. This technique, pandiculation, is where we tighten a muscle, we take a muscle into a deeper contraction than it already is, and then we slowly release that muscle. And it might not be a term that you've heard of before, pandiculation. Most people that I come across haven't heard of it, but you'll be familiar with it because animals do it all the time. So if you have a cat or a dog, as an example, when they get up to stretch, what we think is a stretch, they're actually pandiculating. So next time you see your cat and dog, or a cat and dog, what you think is stretching, they're actually pandiculating. And that's what I'm going to teach you today. I'm going to teach you how to pandiculate some of your muscles. So has anybody got any questions before we go on to the actual looking at the techniques? No, okay. So what I'd like you to do is grab your armchair, sorry, not your armchair, your dining chair, or a chair of that kind of height. Now with somatics, it's not something that you don't need to be able to see me necessarily, because I'm going to ask you to close your eyes. I want you to be able to sense, get an internal sense of how you're feeling inside your body. So I am going to do it alongside you, but you don't actually need to be able to see me. So I'd like you to sit on your chair, but don't sit right to the back of the chair. So make sure that you're sort of perched, not right on the end, but you're, you know, halfway between where the first chair legs are on the back of the chair. So don't use the backrest. And think about where your sit bones are. So just let your arms either rest on your thighs or let your arms hang down by your side. And just think about, try and sit on top of your sit bones. And if you're not sure where your sit bones are, just where you're perched, just roll forward a little bit, and you might find that you've rolled off them, and then roll back a little bit. So just rock forward and rock back until you can find that central point. And hopefully you'll be perched on top of your sit bones. And now I'd like you to just make sure that your feet are about a 90-degree angle to your thighs. It doesn't have to be exact, but just so that your feet are flat on the floor. And close your eyes. And now with your eyes closed, I want you just to notice how your body is feeling. So just take a couple of breaths, just natural breaths, not deep, just your normal breath, and just notice what's going on inside your body as you take a breath in and breathe out. And the sorts of things I'd like you to notice are any areas of discomfort that are showing up for you. So just notice perhaps how your hips are feeling sat in this position. Notice how your lower back feels. Do you sense any tightness in your lower back? Just scan your way up your body a little bit to your upper back. How does that feel? Can you sense where your shoulder blades are in your upper back? Can you sense where your shoulders are? Do your shoulders feel like they're pinned back, or they're rounding forward, or do they feel like one shoulder is higher than the other? So just gauge what your internal awareness is telling you. This might be very different to if you were to open your eyes and look in the screen. In fact, perhaps you could do that, open your eyes and look in the screen and see if what your internal awareness was telling you, is that the same as what you see? It could be different. And then go back to, with your eyes closed again, just notice where your head's positioned on top of your spine. Does it feel like it's rotating a little bit, or does it feel like one ear is closer to one shoulder than the other, or your chin's tipping up a little bit, or your head's protruding forward? Just get a sense of where that your head feels on top of your spine. We always do, we call it a soma scan, because a soma is how you see yourself from the first person perspective, how you see yourself from within. Now, I want you to imagine that your sit bones are the center of a clock. So imagine a clock face, and your sit bones are right in the center. Now, if you were to send your pelvis forward a little bit, that would be 12 o'clock. So let's just do that. Just send your pelvis. So just shift off your sit bones and roll your pelvis forward a little bit to 12 o'clock. You might notice that your back arches a little bit to do that. And then come back on top of your sit bones again. Now I want you just to roll back. Go in the opposite direction. So you're bringing your back a little bit closer to the back of the chair. This is 6 o'clock. So if you imagine that being 6 o'clock, so it's almost like you're slumping at this point, and then come back sitting on top of your sit bones. So we've got 12 o'clock when you send your pelvis forward, and then we've got 6 o'clock when you're going into a bit of a slump. And then imagine all the numbers in between. So just gently rock between those 2 points for the moment. So send and rock forward to 12 o'clock. And then gently come back to the central point. So you're on top of your sit bones, and then go into your slump coming into 6 o'clock. And then come back on top of your sit bones. So the seated clock is more of a directional cue, just so that you know where we're going with your pelvis. So bring your awareness to your pelvis now. And I want you just to roll your pelvis forward to 12 o'clock again. But as you do so, stick your chest out and just look up towards the ceiling. And just get a sense of what's going on in your back. Do you sense your back and the muscles in your back tightening? And then slowly bring your head back down and just rock back onto your sit bones again. Do it nice and slowly. In somatics, we move really slowly and really gently. Just slowly let that effort go. And then repeat that. Do that again. So just roll forward to 12 o'clock. Stick your chest out and look up towards the ceiling, and just pause there for a moment when you're looking up to the ceiling, and just see if you can sense any contraction, any tightening in your back, the back of your neck, in your upper back, all going all the way down to your pelvis. And then slowly release that effort, and come back to sit on top of your sit bones. Lovely. Now let's just go the other way. So let's revisit 6 o'clock. So just go into your slump, roll back a little bit, heading back towards the back of the chair. Notice that your lower back is flattening a little bit. Notice that your rib cage is coming down towards your pubic bone a little bit. You might sense some tightening in the center of the body, and then just come back on top of your sit bones. Do that one more time. Roll to 6 o'clock. Let your rib cage come down towards your pubic bone, and now just tuck your chin to your chest so that you're really curling. See if you can sense your back now lengthening as the front of the body is tightening. And then slowly release the tension in your belly as you come back on top of your sit bones. Just slowly unfurl. Let's add the breath to this now. So we're going to go back the other way. We're going to go into our arch first of all. So I want you to do this as you inhale. So take a breath in and then roll your pelvis forward to 12 o'clock, sticking your chest out, looking up towards the ceiling. So the front of the body is now opening and lengthening. As you look up towards the ceiling, the back of the body is now tightening. Pause when you get there and just take a few breaths as you do that, and then slowly exhale and release back out of it. Do it nice and slowly until you'll find yourself back in that neutral position on top of your sit bones. Now go the other way. This time I want you to take a breath in to prepare. And then as you exhale, I want you to go to 6 o'clock in your slump. Bring your rib cage down towards your pubic bone. Tuck your chin to your chest. Really sense that tightening now in the center of the body. Really sense that. Pause when you get there. Notice how it feels to breathe in this position. Do you sense it feeling a bit tricky to breathe? You're going into the red light reflex here. And then slowly release that effort. As you inhale yourself back. Lovely. Now bring your awareness to your arms, and I want you just to imagine that your arms are like rolling pins, and so your thumbs at the moment are facing forward. I want you to roll your arms in towards the body so that your shoulders round forwards until your thumbs are now pointing behind you and your little fingers are now pointing forwards. The back of your hands are facing your thighs. And then slowly release that effort. Just nice and slowly let that go until your palms are facing your thighs again. Do that again. Roll your arms in towards your body. Just roll them in. See what you sense. Can you sense any tightening in the front of the body? Close your eyes and see if you can really sense that. And then slowly let that effort go. Now this time, I'd like you to, as you roll your arms in towards the body, I'd like you to see what happens to your shoulder blades. So again, let's do this as you exhale. So take a breath in to prepare, and then as you exhale, just roll your arms in towards the body and notice what happens to your shoulder blades. Do your shoulder blades slide away from the spine? See what's going on with your shoulder blades, and then slowly let your shoulders come back to neutral. Now we're going to add this arm movement to the flattening movement we just did. So I'd like you now to take a breath in to prepare, and then as you exhale, roll your pelvis to 6 o'clock. So you're going into your slump, and then roll your arms in towards the body. Tuck your chin to your chest. Getting this rounded shoulders posture, this red light reflex, and then slowly come out of it. See how slowly you can take, how many breaths can you take to come out of it? Do it nice and slowly. I'll do that one more time. But this time, as you do that, we're going to squeeze our knees together. So inhale to prepare. And then as you exhale, roll your pelvis to 6 o'clock. So you're going into your slump, your back's flattening. Roll your arms in towards the body. Tuck your chin to your chest and squeeze your knees together. Really sense that tightening, that contracting, that full contraction on the front of the body. Just pause when you get there. Continue to breathe, but just pause in that position and just get a sense of what it feels like. And then slowly release that effort. Let that effort go. Let your knees soften. Bring your pelvis back to neutral, so you're back on your sit bones, and just let your arms roll back. And take another breath when you get to the end. Now, just like your arms roll inwards, they can also roll outwards. So just take your arms and imagine that they're still rolling pins. Roll them away from the body. And notice that as you roll your arms away from the body, notice how your shoulder blades come closer to the spine and your chest sticks out a little bit more. And then slowly release that effort of your arms. Do that again. This time, we're going to add the movement of the pelvis. So take a breath in, and as you inhale, send your pelvis forward to 12 o'clock. So your chest is coming out, you're looking up to the ceiling, and then roll your arms away from the body. Really sense that tightening now in the back of the body, all going down the back, all the way perhaps to your glutes. See what you sense. And then as you exhale, slowly let that effort go, let that tension go. Let your arms roll back, let your pelvis return to neutral on top of your sit bones. This movement's called the flower. And as we do our arch and roll our arms away, the flower is opening. So let's do that again. Inhale, roll your pelvis to 12 o'clock. So we're creating our arch. Roll your arms away from the body, look up towards the ceiling. We're triggering the green light reflex, the Landau reflex. We're triggering it. We're recreating it so we can decreate it, and then slowly, slow motion release, just letting it go. Beautiful. And let's go straight into the flatten. So take a breath in to prepare. As you exhale, roll back to 6 o'clock, roll your arms in towards the body, bring your chin to your chest, your rib cage comes down, squeeze your knees together. And then take 2 full breath cycles to slowly unfurl. We're in a closed flower now, and we're slowly going to let those petals open. Nice and slowly as we come back. Beautiful. Now we've just worked on releasing the muscles on the front and the back of the body. Let's do a little bit of work on our shoulders. So let's just start with just bringing your shoulders up towards your ears. So like a shrug. And then really slowly let them come back down, nice and slowly. The slower, the better. Just notice what's going on as you bring your shoulders back down. Do they come down nice and smoothly, or was it a little bit jumpy, jerky? So do that again. Bring them as high up as is comfortable. Only move within your comfort zone, and then slowly let them come back down. Does one want to release quicker than the other? Can you have control over both shoulders? What's going on for you? Slowly let them release. Now just bring your attention to your right shoulder. Let's narrow it down a little bit. Sometimes too much information can be confusing for the brain. So just bring your focus to your right shoulder. This is my right shoulder. I know sometimes it can look funny on Zoom. So I want you to just bring your right shoulder up towards your right ear. And then slowly let it float back down. Notice what happens. How smooth can you let it come back down? How gently can you let it come back down? Is there any jumpy, jerky shakiness? Now, when it's back down to neutral, I want you, this might be better if you just let your arms hang down by your side rather than your arms being on your thighs. Just send your shoulder downwards, away from your ear, just as far as is comfortable. And then slowly let it come back to that neutral position. Do that again. Just send that shoulder away from your ear. I'm not going to tip my head. I just want a shoulder to move away from my ear. And then gently let it come back. So we've got two movements there of our shoulders. We've got an up movement and we've got a down movement. So now I'd like you to send your shoulder forward. So just round your shoulder forward a little bit. If you want to, you can let your arm roll forward as well, like we were doing a moment ago. So your shoulder's coming forward. And then slowly release that effort. How far forward are you able to go with this shoulder? Just roll it forward again. Notice how far your range is. And then gently bring it back to your neutral. And then send your shoulder back. Your arm can roll a little bit out if that feels like it wants to do that. Just roll and send that shoulder back. And then bring it back to neutral. So we've got an up and a down movement of the shoulder, and we've also got a forward and a backward movement. So close your eyes for this and see if you can really sense this. Bring your shoulder, your right shoulder, up towards your ear, and then bring it back towards the chair, bring it down towards your feet, and then bring it forward. Bring it up. See if you can hit all of these points. Bring it back, bring it down, and bring it forward. Now we're creating a circle here. How smooth can you make this circle? Are you able to join each of these points up with an arc, creating a nice, smooth circle? What else in your body is moving in order for you to help you do this? Just allow it to move. Don't hold other parts hostage to this movement. A sense of how that feels. Now make the movement even smaller. Go really small. So we're going to go up, back, down, forward. And this is really hard. Do it really slowly. Really sense what's going on in your shoulder. If you sense any jump, jerky shakiness, then that's probably because there's some sensory motor amnesia there. So slow it down even more. See if you can smooth it out even more. And then slowly make that movement gradually get bigger and bigger until you're at your end of range in all directions. Now, let's go the other way. Let's see if going the other way is harder or easier. So bring your shoulder up towards your ear and then send it forward, then go down and then back. So we're going to go up, forward, down, back. Continue with that. Let your arm roll. So as you roll your arm back, your shoulder back, let your arm roll back if it wants to. Bring it up, forward, let your arm roll forward, bring it down, bring it back. Let the whole arm get involved. Let the head move, whichever direction the head wants to move. And then slowly come to a still point. And with your eyes closed, just bring your attention to your left shoulder and your right shoulder and just notice how they feel in comparison to each other, having that we've only worked on the right side. Just notice that. Now let's do the same on the left side now. So let's just start by looking at these positions individually. So just start by sliding the left shoulder up towards the left ear. Notice how that feels. Notice the muscles, the trapezius muscle tightening here as we do that. Now slowly release that effort. Slowly let it go. Is it easier on this side, or does it feel harder? Have you got as much range? Try it again. Bring it up towards your ear. Sense that trapezius muscle tightening and contracting, and then slowly let it go. How smooth is that movement to let it go? Any jumpy, jerky shakiness here? Make sure that you're not doing anything that's causing you any pain. If you've got any pain or discomfort, or it's triggering any spasms, just make the movement smaller. Now, let's go the opposite way. Send your shoulder down towards the floor, just your shoulder, and then slowly let that go. Have you got more range going up to your ear or down to your shoulder? Just repeat that a few times, just to notice what's going on. This is really fine-tuning your awareness. So we've got the up movement and we've got the downward movement. Let's send your shoulder forward now. So just round it forward. Let your arm roll forward as well till the little pinky is pointing forward and the thumb is pointing back. Sometimes helps to round that shoulder, and then let it come back to neutral. Now let it round back. So your whole arm can roll away from your body as well. Feel the lengthening in the chest muscle. Feel what's going on in the shoulder blade, and then slowly let it come back. So we've got our forward movement. The tightening, the pecs are tightening now. Slowly release that and then take it back. Feel that tightening now between that shoulder blade and that left shoulder and the spine, all around there. Slowly release it. So let's put it all together. Let's bring the shoulder up towards our ear. Let's bring it back towards the chair. Let's go down towards the floor and then forward. Up to the ear, back to the chair, down to the floor and forward. And just continue with that in your own time. Really round it out. Really smooth the movement. If you find any jump, jerky, shaky spots, just stop at that point and see if you can really slow that down and smooth it out. Make the movement smaller. Try that again. How small can you make the movement but still stay in control? What are you sensing? And then slowly allow the movement to grow until you get to your full range. How does this side compare to the other side? What's going on in your hips as you do this, in your pelvis? Do you sense your hips and pelvis moving? Try going the other way. So bring it up to your ear, bring it forward, bring it down, bring it back. Up, forward, down, and back. Is this easier to do? Or does this feel a little bit more alien? Beautiful. And then slowly bring it to a nice still point. Just close your eyes and tune into your shoulders and just notice how your shoulders are feeling now. Do you feel a little bit more evenly balanced than you did at the beginning? Now, I would like you to bring your attention to your sit bones again. And just like we've got 12 o'clock when we send our pelvis forward, and we've got 6 o'clock when we go into our flatten, we've also got 3 o'clock and 9 o'clock. So I'd like you to just shift your weight from your left hip into your right hip so that you're going into 3 o'clock. And notice what happens to the waist on your left side. So your left hip is lifting a little bit and your right hip is pressing down into the chair. Your left hip is hiking a little bit and tightening, and then slowly release and come back to your neutral on your sit bones in the center of the clock. Just do that again. Shift your weight onto your right hip, allowing your left hip to lift off the chair a little bit. And then slowly come back to neutral. Let's go to 9 o'clock. So this time, shift your weight. Now you might find that you press into your foot a little bit. You press into your right foot a little bit in order to shift your weight into your left hip now. Your right hip now is lifting and the waist side of the body is now tightening. We're addressing the trauma reflex here, and then slowly lower that right hip down. And just do that one more time. Shift your weight into your left hip, allowing this tightening of your right hip. And this time, just reach down with your right arm. So really intensifying that tightening in that waist. Bring in your right armpit and your right hip towards each other. Let your head come along for the ride. And then slowly let that effort go. Let that hip come back down onto the chair. And just release that effort. Now let's go back to 3 o'clock again. So shift your weight onto your right hip. Your left hip is lifting off the chair. The left waist muscles are tightening now. Notice how my right waist muscles are lengthening. And then reach down with your left arm. Let your head follow. Just pause there for a moment. Feel that tightening of the waist. And then slowly see if you can release from the waist to bring yourself back to neutral, letting everything go. And then just gently rock between the two. So go into 9 o'clock on your left hip, reach down with your right arm. And then slowly, as you lower your hip back down, your right hip back down, lift your left hip back and reach down with your left arm. Let your head come down as well. And slowly let that go. And rock from one side to the other, but do it nice and slowly. We're not just rocking, we're tightening in the waist, and then we're releasing to lower that hip back down, and then we're tightening in the waist to bring the other hip back up. We're reaching down with the arm just to intensify that tension, that contraction on the side of the body, and then slowly let that effort go. Let it go nice and slowly. Beautiful. Can I invite you to come to standing? No, actually, before we come to standing, stay where you are. Just close your eyes again. Just put your hands on your thighs. Feet are positioned flat on the floor like they were at the start. And that you're sat on top of your sit bones again. Just notice how you feel now. Notice if anything's changed, if anything's different. Do you sense more that's going on in your body than you could at the beginning? Is it more comfortable to sit here in this position now than it was at the start? Just what do you feel? Notice how your hips and your pelvis is situated. Notice the contact that you have with the chair in this area. Notice your lower back. Is that a bit more comfortable if it wasn't at the beginning? Does it still feel quite arched, or does it feel a little bit more relaxed? Bring your awareness up to your upper back and your rib cage and your shoulder blades. Just notice how this area feels now. Do you sense any more length in your body? Notice your shoulders and the position of your shoulders, and whether your shoulders feel like they're still rounding forward, or does one still feel higher than the other if it did at the beginning? Just what's going on for you? And where's the position of your head now on top of your spine? Does it feel more vertical than it did at the beginning? Just see what you sense. And then find your way to standing. Just move your chair out of the way a little bit. And I'd like you just to, we're just going to do some reaching movement. So take your left arm and just imagine that you're trying to pluck an apple, reach for an apple on a tree. So I want you just to reach with your left arm up high above and pluck that apple, and then come back down again. And do that again, this time as you reach up. Put all your weight into your left foot and lift your right foot. Reach up with your right foot so your toes are just touching the ground of your right foot. See if you get more reach by doing that, and then slowly come back down, and then go to your right arm and lift and reach up with your right arm. Put your weight into your right foot. Let your toes, let your heel come, your left heel come off the floor to help with that reach, and then come back down, and then just alternate between the two. So reach up with your left arm, your left heel is coming up off the floor. Notice how my right heel is coming off the floor, my right waist is tightening a little bit, and then just gradually go between the two. This is great for if you've got to reach things on a high shelf in the kitchen. Just flow between the two. And then just come to a still point. Just go and have a short walk around your area, and then come back and join us. Just when you're on your walk, just notice how it feels to walk. And then I will unmute everybody, I think. Yes, I can't remember how to do it. Here we go. Hazel, are you on? Has everybody unmuted?
Yeah.
Yeah. Okay. 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 So how's everybody doing?
Yeah, good.
Really good.
Yeah.
Yeah, good.
Do you feel a little bit more conscious of how your body is moving, how your body feels right now? Anything show up for anybody?
Yes, I have tension in my left shoulder normally, and it's gone.
Oh, brilliant.
Hmm.
What's the tension from?
I had a broken collarbone, and the bone has shortened ever so slightly, so it tends to pull forwards, and I have to do regular work on it.
Excellent. So that shoulder work that we were doing would be really useful for that. Really, really good. Thank you, Hazel.
I got, when we were doing the shoulder work, I got pins and needles running down the back of my shoulder blade, but my neck now feels a lot looser. So,
Brilliant. How bad were the pins and needles? Did it
like a little bit like a nettle rash, but I have to tell you, I have a lot of problems with my back because I was born with spina bifida. And I've had several operations on my back, so it's all out of kilter. So that felt good.
Thank you, Tricia. Thank you for that. So has anybody got any questions they'd like to ask about anything that we've done today, or anything that I said at the beginning, or anything at all, really?
I think it's a fantastic self-care therapy.
It is, yeah, I'd agree. And one of the things that I like about somatics is that I don't know how many of you are massage therapists, but I love going on my massage training, but I can't do it to myself in the same way, you know, whereas the somatics, everything I've learned on somatics, I can do for myself, and it's just fabulous. I love that.
Absolutely. I think, you know, over these lockdowns, I think we've realised that our clients come to us regularly hoping we will fix them, and then go back to their daily lives forgetting everything we've said in the room, and then come back to us the next month for exactly the same treatment. But
Yeah.
I think with this, I think especially where people got used to Zoom, you can follow on treatments and they can do it themselves, and they feel as though they're in control of what they're doing and taking responsibility of their self-care, aren't they?
Absolutely. And that's one of the reasons why I went down this road, really, to give people that option. I was just fortunate that I went down when I did with COVID. But yeah, absolutely, Jo.
Yeah,
Absolutely.
brilliant. I'll be interested. Sorry, I keep on talking. I won't talk anymore.
No, that's all right, Jo.
Is there anything for? I suffered from severe anxiety over these last lockdowns, and I've noticed I've been clenching my jaw so tight that I've now got I can't open a jaw and it clonks. So is somatic something? Is there like your techniques there? Could it be used for the jaw as well? Can it be used for anywhere in the body?
Yeah, and you can also add things like yawning when you're doing the movements and things like that. I'm running a couple of things next week. I've got an introductory to somatics. It's a 5-week course. It's predominantly lying down, so that will be good also for TMJ or anything kind of that nature. But the last session I always have as whatever the group kind of wants. So we can either consolidate, or I have done seated, or whatever the group wants. So that starts next week, next Tuesday. And I'm also running a taster session in about 4 weeks' time, which is just a one-off session, but it's more of a lying down taster session. So you get to kind of explore somatics in a different position, really. So food for thought. And then I do run weekly classes, but you need to have done some somatics first. You'd need to have done the introductory block before you come to classes, because it's just so different to other modalities. You would feel really, you know, lost. So if that's of interest to anyone, let me know, and I can send Jackie the details, or I can send you the details directly.
Alison, what time?
Oh, sorry, Natasha, I missed you then.
What times will the introductory classes be?
They run at 6 o'clock UK time, 6 till 7:15. They start on the 27th and 27th of April, and it's for 5 weeks.
Okay, that's great.
So that's an hour earlier than what we've done tonight, isn't it? So roughly, yeah.
Times
Yeah.
perfect.
So if you'd like details, Natasha, then I'm happy to forward that on to you.
Yes, please.
Yeah, me too.
Does the
Okay.
5 weeks cover the whole body?
Sorry, who said that?
That was Lorraine.
Lorraine. What we do in the 5 weeks, we look at I look at releasing muscles on the front of the body, the back of the body, the side of the body, and then we do some rotational movements. So there's a bit of a theme for each of the classes. By the end of the 5 weeks, you will have enough information to basically, if you want to continue practicing, the idea is about developing a somatic habit. It's like, you know, if you think that you clean your teeth to prevent tooth decay, somatics is to keep your body functioning efficiently. So it's not to say that you would have to do somatics practice for an hour every day, but the idea is that if you did 10 minutes most days, that would be enough to reset your body so that you wouldn't get aches, pains, etc. And yes, it will cover the whole body because somatics, the patterns work on addressing the whole body rather than on isolated areas. Does that answer your question, Lorraine?
Yes, thank you.
Okay, you're welcome. You're welcome. So, will I put my details in the chat? Would that help? And then,
Yes.
but if anybody wants, would that be an idea?
Yeah, good idea.
Okay. So. I've also got I'll put my website details in here as well.
So I can put them within the group when I post this.
Okay.
Put all your details within there, so people within the group will get it. If they're not in the group, they could write to me and I'll just send it to them. Save doing it now, if you like.
Okay. All right. Perfect.
Yeah.
Then that would be great, Jackie. Thank you for that.
Yeah.
So
yeah. I got all your details off your website. I'll put it in the event, so I could just copy it there and put it on your thing. It's got all your details.
okay. Fantastic.
Okay.
There we go.
That's right. So
yeah,
that was really, really good. Thank you. Thank you very much. Very interesting.
you're most welcome. Thank you for having me, Jackie.
Very interesting. Thank you for coming. Thank you for coming, ladies. And I'll put the recording within our FHT group. So if you, and I'll also put a CPD certificate on the group as well. So yeah, so enjoy the rest of your evening, everyone.
Thank you very much.
Thank you.
Thank you.
Bye.
Thanks a lot.
Bye.
Bye.
Bye. Bye.
Bye.